let's get your number on how much you spent. Because for context, Maddie and I went through our private health kind of claim history because we were both really curious to see how much money did we actually spend on it.
Look, in chronological order from like most to least, it was psychologist, gym, osteo, psychiatrist, GP. Yes. So we racked up a grand total. It's a ballpark, right?
Yeah, good.
Around 5.5K. Which
Nice. Was that including your gym?
that was including the gym.
Nice,
Yes.
nice. Okay, so big key part there is including the gym.
Including the gym.
And for those that don't know, what gym do you go to?
Oh no, I don't want anyone.
You're right.
me.
No,
Yeah.
but is
Actually,
it
to be
is it
fair,
a?
I feel like I posted on my story last week. Or
And I was
something.
about to say, I feel like we've definitely spoken about it before.
EMF.
Yeah, but yeah, obviously a gym that's like a little bit exy.
I think the gym culture, I don't know if it's a Sydney thing or a Shire thing. It's a little bit culty. It's not cheap, but health is wealth.
Health is wealth, but also like we choose to go to a gym like that for not just the
Our social health.
social health, but also like and variety of different avenues that you can
Exactly.
express that. So,
All right, what about you?
well, mine, so across the year, so I was looking back on it, I was pretty basic. Actually, I forgot to add one more to my list of things that I saw last year. Mine was pretty basic though, in all honesty. So I saw the GP a handful of times. I had like a really random like infection thing that we were getting like really worried about. I was like, oh my God, this could be like
I forgot about that.
yeah, random. So I had to like randomly go into a GP. I didn't even know GPs were open on a Sunday, but I had to go and see a GP on a Sunday and just be like, hey, what is this?
My foot's on fire.
Help. But yeah, so I had like a random 1 or 2 appointments with a GP for like random things like that. But across the year, I saw dentists,
Yep.
osteo,
Yep.
and osteo was a big one. In my
Osteo
in my
saw
pool.
an osteo.
And for context, I did start up basketball again last year, like full on. So I was like all systems go. So when I say that I was seeing the osteo, like I was seeing it more to be on the front foot with the body.
Yep.
And hand in hand with that, I was also seeing massage therapist. And then I was seeing Elizabeth from the Dow as well. So I started seeing her on the back end of last year.
Yep. For anyone that doesn't know, Elizabeth at the Dow and the Dow, it's a Chinese medicine.
Chinese medicine, yes. Traditional
Yeah.
Chinese medicine.
Yes. TCM.
And acupuncturist. So I was seeing her on the back end of the year too, which was cool. But all up in like my allied health category, not including GP, because I roughly went maybe like 5 times to the GP, 4 times to the GP, but some of it was literally just like give them a buzz on the phone to get a referral for some bloods.
Right, gotcha.
So like I don't know if I mean I do count it. It's like $90 a pop for the GP, so $500.
Yeah, chuck it in.
Let's add the extra 500 on top.
Chuck it in. Round up.
I'll round it up.
Add some GST.
There you go. Add some GST. So all up for the allied health, the GP, them in total was about 2,500.
Yep.
And then for the gym membership, it was about 3,000 all up. So roughly the same, about 5.5.
Yep. Okay.
5.5. Pretty on the money.
Okay.
We didn't actually get any stats at what the actual
Average is.
Let's chat GPT it.
While you're doing that, I'm going to throw a curveball.
Shoot.
Is there anything that you regret spending your money on last year?
Ooh. Wait, are we just talking about healthcare?
Yeah. Not some Temu purchases.
What were we asking? What is
there
the
anything? Oh, yes.
average amount spent?
In Australia
This is my like needing to.
on healthcare? You're typing with both thumbs and it's actually freaking me out right now.
Well, it's an iPad. It's big.
No, it's weird.
Things that I spent money on
That you regret.
I regret.
Healthcare. Like any wax supplements that you're like, that wasn't good.
I actually am going to say no, as weird as that is. So upon reflection, I feel like a lot of the stuff that I spent money on, I might not have needed. So for example, like the osteo, the massages, the TCM, like people would argue that like there's nothing necessarily wrong that's
Preventative.
kind of like, enticing me to go and see them. But for me personally, it was more a matter of actually going to see them on the front foot. So I didn't end up spending more money on anything, if that makes a bit of sense.
Like preventative health?
Yeah, so like trying to be a little bit on the front foot, preventative in the grand scheme of, right, like now I don't need to go and spend a stupid amount of money on my healthcare because I've cooked myself.
I think it speaks quite nicely to, I guess, what I've noticed the attitude is in the Australian population when it comes to healthcare. Like, again, we really want to acknowledge our privilege when it comes to having these funds available to spend on said services. But I do feel like there is a bit of an attitude of like, we only go and see someone or get something addressed when it's an issue and when it's impacting our day-to-day lives.
Yeah, absolutely. I agree.
Yeah.
And I think that's that's conversations changing a lot now. And like we've both spoken about the fact that we think that things are kind of changing here and there in that landscape, but it's not going to change overnight like
younger
that.
populations for sure.
But even then, like I think younger populations still need the message to kind of be banged home a little bit because I mean we're living in a world now with an aging population and like as a country we're spending a lot of money on healthcare. And I think as like a younger generation with a lot of these private health insurance companies or, you know, like a lot of these private health or allied health interventions becoming more available to people are becoming more aware of the benefits of them. I think it'll only continue to evolve that conversation more. But here you go. Here's the stat. Yeah. So, I mean, so you spent roughly like 5.5. I spent roughly 5.5. And it said, and it doesn't have last year's estimation, but roughly in the 2021-2022 financial year, it was just says Australia's total health expenditure was approximately $241.3 billion, averaging about 9.365. So 9,365 per person.
Jewish.
There you go. So, you know, and I mean, that's only an average. So I'm sure there's people spending a lot more and people spending a lot less, and it kind of takes it somewhere in the middle.
Yeah, right.
But there you go.
Interesting.
5.5.
Very, very interesting.
Very interesting. Thanks for listening to this week's podcast.
Be the first to know when the next episode drops by hitting subscribe on wherever you catch your podcasts.
And don't forget to follow us on Instagram at we don't know yet.pod.
See ya.